Hi, I'm Dr. Saqib Mansoor, and this is my channel Learning Anatomy. And today's topic is complete cord transection syndrome from a series of lecture on the spinal cord clinicals, right? This is a cross section of the spinal cord, right? And these lines, the reddish lines, show the transected area, right? And you see this gray matter in the center. This is the, butterfly shaped, this all, see the red laser. This is, sected, and this white matter, see the red laser. This is the dorsal column, and this is anterior portion, and this is the lateral. All are transected. And see this term, destructive spinal cord syndromes. When neurologic impairment is identified following the disappearance of spinal shock, it can often be categorized into one of the following syndromes. These are the 4 syndromes, right? Destructive spinal cord syndromes. Number 1, Brown's cord syndrome or hemisection of the cord. Number 2, anterior cord syndrome. Number 3 is the central cord syndrome. These 3 are already uploaded on my lecture discussed with you. Number 4, today's topic is complete cord transection syndrome. Clinical findings often indicate a combination of lower motor neuron injury at the level of destruction of the cord and upper motor neuron injury for those segments below the level of destruction. Complete cord transection syndrome. It causes complete loss of all sensibility and voluntary movements below the level of lesion. Factors causing it: fracture, dislocation of the vertebral column, a bullet or stab wound, or an expanding tumor. These are the causative factors, right? Obviously, as the whole of the spinal cord is involved, the motor and sensory, both the systems are affected. Complete cord transection syndrome continues. So following characteristic clinical features are present after the period of spinal shock is over. These are the 4 characteristic features. Number 1, bilateral lower motor neuron paralysis and muscular atrophy in the segment of lesion. It results from damage to the neurons in the anterior gray columns, that is lower motor neuron, right? These are the lower motor neuron areas, right? Follow the laser. And possibly from damage to the nerve roots of same segment. Number 2 is bilateral spastic paralysis below the level of lesion. A bilateral Babinski sign is present, and depending on the level of segment of the spinal cord damaged, bilateral loss of superficial abdominal and cremaster reflexes develops. All these signs are due to an interruption of the corticospinal tracts on both sides of the cord, right? Obviously, we know that this is an upper motor neuron lesion, and Babinski sign is present in that. The bilateral spastic paralysis is produced by the cutting of the descending tracts other than the corticospinal tracts. Number 3, bilateral loss of all sensations below the level of the lesion. So you see the segments. This is the dorsal column medial lemniscus system. This is the fasciculus gracilis, fasciculus cuneatus, right? Both sides. And this is, the dorsal column, and it is responsible for the sensations of tactile discrimination and vibratory and proprioceptive sensation. These all would be lost as this is damaged. Posterior white column. And this spinothalamic tract, this anterior and lateral spinothalamic tracts are damaged, loss of pain, temperature, and light touch sensations. As these tracts cross obliquely, the loss of thermal and light touch sensations take place 2 or 3 segments below the lesion distally. So bladder and bowel functions are not under voluntary control. This occurs as all descending autonomic fibers have been destroyed. In case of a complete fracture dislocation at the L2-3 vertebral level, that is a level below the lower end of the cord in an adult, no cord injury is seen, and neural damage is limited to the cauda equina, and lower motor neuron, autonomic and sensory fibers are involved. Thank you very much for listening to this short lecture. And next, I will upload the lectures on like tabes dorsalis and amyotrophic lateral sclerosis. And please support my channel by subscribing, commenting, and sharing. Thank you very much. Take good care of you, and bye.